As the FDA and CDC assess COVID-19 vaccines for kids under the age of 5, Robert Wood Johnson Foundation has some rollout recommendations. Joining us this morning, Dr. Julie Morita, Executive Vice President of the Robert Wood Johnson Foundation and a member of the CDC's Advisory Committee to the Director. Good morning, how are you?
Good morning, how are you doing?
Doing pretty good, thanks for coming on. So I'm triple vaxxed, but I'm the parent of a 2-year-old, and so I'm going to have a lot of questions, I think, about a 2-year-old, and I think most parents will. So why is the rollout here important, and what is your role in the rollout? Is it to increase trust in the process and in the vaccine? Or?
Right, so it's important. This is a critical piece of unfinished business as it relates to the pandemic response overall. We've been able to get vaccines and make them available and roll them out to our children, everyone 5 and older, but our under 5s have really remain unprotected. So what's going to be critical right now is really helping parents to understand how important these vaccines are and that there is still a risk to their young children for getting sick. I think what we are seeing is that there's pretty low immunization coverage levels for children 5 and older, just because parents have a sense of their children not being at serious risk for infections. But we know that millions of children have actually gotten infected, and thousands of children have gotten severe inflammatory disease, and over 1,000 children have died because of COVID. So it's really important for people to understand the importance of vaccinating children.
Yeah. What lessons have been learned from previous rollouts with kids?
I think it's really important that children in general are well connected to their healthcare providers. So most children have a family doctor or have a pediatrician that they go to, and that pediatricians and the family doctors and public health officials are the trusted sources of information for parents. So because we see that many children have yet to be vaccinated who are eligible already, it's really important that healthcare providers talk with parents. The parents seek out their healthcare providers to have their questions answered so they can be comfortable getting their vaccinations.
And a lot of the kids above 5, they haven't gotten the second dose. Is that part of your education as well, as to get both doses, get the full thing?
Right. I think it's really critical that right now these children can get their second doses. So we think about 30% of children 5 to 11 and about 60% of children 12 to 17 have actually gotten the 2 doses of the vaccine. So many children are unprotected. So now is a great time for those children to get vaccinated, because when the vaccine becomes available for children under 5, the demand will be even greater. So it's important for people to go out and get those vaccines as soon as they can.
So what are the steps that your group is taking to educate about the kids under 5?
Right. So I think a critical thing, again, comes to who the parents actually trust and believe as sources of health information. And what we know is that parents generally trust their pediatricians, generally trust their family physicians and public health officials. And so a lot of work is being done to make sure that the pediatricians and family physicians and public health officials are equipped to be able to answer parents' questions. The reasons that people are hesitating is mainly because they're they want to protect their children and keep their children safe. We just have to keep reminding people that the pandemic is not over. We're still seeing 100,000 people a day getting infected with COVID. There's still people getting hospitalized. There's still people that are dying. And so the pandemic is not over. And in addition to that, even though children may be at lower risk than older adults and people with underlying health conditions, they still are at risk for serious infections, and we want to protect them as best as we can.
Dr. Julie Morita, thank you so much. We appreciate you.
Thank you. Take care.
You too.